Thanks, Kevin. Fortunately, I had many years to learn from Kevin, and it's always been a mutually beneficial relationship in terms of growth and change. I think he underscored a couple of things that I just wanted to highlight as well for you, and that is that because of these dependency relationships, we have to understand that solutions to these issues requires a collective commitment to work together to find those solutions. We used to talk about the enterprise at ASPR, the notion being that an enterprise is structured around taking on a very difficult and complex task that requires the skills and the capabilities of a wide range of players, scientists, academicians, industry, politicians, and I think Kevin helped us to see that a little bit as he was describing the dependency relationships that we have. Collectively, we can find solutions potentially that individually we cannot. I also want to pick up on your theme that what's Plan C? What's Plan D? What's the oh crap solution going to look like? And so we need to be thinking about that as we proceed. Now, before we go to the first presentation, and really the first presentation is really a more didactic presentation that focuses on getting us into common terminology and thinking about what does shortage mean, what are some of the underlying factors, what's the challenge then that presents to sourcing and distribution, et cetera. So it is more of a formal presentation. But the balance of the structure of this 2 days is really focused around dialogues and discussion. We'll follow the first panel presentation with a second panel that explores what are the impacts of shortages on providers, on patients, on systems. We'll have a discussion then about what are people doing currently to try and address some of these issues. Then that'll lead us to a discussion of, well, given that, what are the gaps? What are the challenges? And we'll finish the day looking at 4 scenarios of how shortages play in disaster, using scenario-based discussion amongst us to think about how do we deal with each one of those variants. Tomorrow we'll begin to focus on what are the predictive improvements that we can do. How do we provide planners at the community, the state, the national level with the kind of predictive tools, the databases that will allow them to understand what the background challenge is so they can predict how that's going to impact on their response planning. We'll then have a discussion of what can we do to mitigate or prevent some of those things. And then we'll have a discussion of what does that mean in terms of response operations, and what can we do in that world that will help planners at the local, state, and federal level be more effective. So over this 2 days, we'll get a common set of terminology, we'll get a common, hopefully, understanding, at least a shared understanding of how this problem looks, what's being done now, and where we can go in the future. So we think it's nicely structured to sort of progressively work our way towards answering the charge that Kevin just gave us to help them come up with ways to think about Plan C, Plan D, et cetera. So our first panel this morning, and I'm going to invite our presenters to come up here and take a chair. They will be presenting from the podium as opposed to sort of a discussion dialogue session. And while they're coming up, and Doug, Ernst, Scott, James, please come up. Introduce yourself to the person next to you if you don't know them, where you're from, and what you think this is all about, and how you can contribute. So take a minute or two to just do that. Ernst. Thanks for coming. You doing well? I'm already dropping you. Dropping your name. Hi, Doug. Good morning, sir. How are you? Okay, you've been talking amongst yourselves, and hopefully you're coming to some comfort with the people that are sitting near you if you don't know them. Again, if we don't work together on this, we won't get very far. So this first panel this morning is really titled Establishing a Shared Understanding of Medical Product Shortages, and it's a complex challenge. And it aims to describe the medical supply chain and common disruptions that contribute to shortages and their causes. This sets the background for what we're faced with in disaster environments. We're going to consider how public health emergencies can exacerbate medical product shortages and discuss a bit the economic drivers that are contributing to medical product shortages. We've invited a number of folks to help us and make sure that we're all on the same page as we're speaking about this, and they come from a variety of different perspectives. And again, I'm not going to go into lengthy bios for these folks, and I would invite you to get yourself a copy of that package of bios, because this is a pretty august and importantly practically rooted group of people. First, we're going to have Doug Throckmorton, who's the Deputy Director for Regulatory Programs at the Center for Drug Evaluation and Research at FDA, and this goes to Kevin's point about FDA taking the lead on dealing with shortages overall, and Doug's going to describe for us some of that work and some of the databases that apply, et cetera. We have Ernst Behrendt, who's a Professor of Applied Economics at Massachusetts Institute of Technology, and he'll provide us some insight into how economics, globally and domestically, are influencing some of these activities at the production and distribution side, et cetera. Scott Knorr comes to us from Cleveland Clinic, where he is the Chief Pharmacy Officer there, and he's going to look at and describe for us some of the systematic forces at play in the provider and hospital arena. And lastly, we'll have James Callahan, who's the Senior Director, I've already mentioned him without saying his name, the Senior Director for Global Business Resilience and Enterprise Risk Management for AmerisourceBergen. And they will each come up and make a presentation and then hand off to their next person in line. And I'm looking forward to hearing from all of you. And Doug, why don't you kick us off, buddy?